Hydrotherapy is effective because you're using the increased heat from the water to induce a pseudo fever and increase the body core temperature. When you do that, remember those guys that fight for you, the natural killer cells, the monocytes, the macrophages, those white cells, they start to do their job and they become more activated. So there are different hydrotherapy that we can use. The first one, washing your hands. You really have to wash your hands very well with soap. And this cannot be overemphasized, especially during a pandemic with this horrible virus, which is so well killed with soap and water. We have to drink enough water. We have to give ourselves about 10 glasses a day. I know we've been saying 8 for a long time, but 8 is just a conservative number. You need a little bit more than 8 glasses if you want optimal cleansing potential. We want to give our children water as their first choice of drink. Now, COVID-19 has forced many of us to change things to a way that we never thought we could. And I want to suggest that we consider changing our drink of choice in every home to water, not juice, not soda. We don't need any of those things. And children just need water. So a 5-year-old can drink up to 5 8-ounce glasses of water a day. A teenager should be drinking 8 to 10 glasses a day. So please don't give them juice, give them water. Now, we spoke about contrast shower, and I know you do them faithfully. I do. I'm not as much of a warrior as you are when it comes to the cold part, but I am trying to get better with the cold. But this does help to boost the immune system. We did not speak about steam inhalation last time. Now, if you have issues with a congested sinus, whether it be from allergies, infection, pollen in the air, this works great. What you would do is get this. In this picture, this lady is taking the steam directly from her kettle and covering her head with a towel. You're covering your head with a towel because you want to keep the heat in. So I'm going to just show you here. If you had a towel, you just put it over your head and go over the source of steam and breathe in and out with your head over the steam. I don't use it like that because I don't want to be near to the hot plate or the stove. So I boil the water, pour it into a bowl or a basin, and then I usually add a few drops of peppermint and eucalyptus because those, they give a kick to that steam. They help to dilate the bronchioles, to moisten the mucus so it's going to come up and you'll have to blow it out or cough it out. And you can, and sometimes you can add onions, because those also have a mucolytic, a breaking down of mucus effect. And you can do this for about 10 to 15 minutes, and it really works. Years ago, I had issues with my sinuses, not anymore, thank God, but I had years ago, and I would do this, and it really does open up the sinus passageway and the lungs. You can use this if you have asthma, if you have coughing from bronchitis, and if, say, you have COVID-19 and you feel a little bit tight, but you're not sick enough yet to go to the hospital, this is a measure you can use to get some relief in your throat and your lungs. If it feels too tight. So steam inhalation can be done. Be careful with kids, they can't go too close to the steam because steam is hot water, so it can burn, but just monitor carefully that they're not getting too hot and that you also are not going to burn yourself. We spoke about a hot foot bath last time, but you can also do a hot foot bath where you alternate hot and cold. That gives even like a boost. It's a little bit more potent than the regular hot foot bath. You put your feet in hot water to about 104, 105 degrees Fahrenheit, and you leave it there for 3 minutes. Then you transfer to cold water for about 1 minute. Now, this again, what it's doing is increasing the blood flow, because in the hot, you had vasodilation. Your blood vessels were opening up. In the cold, you have vasoconstriction. So now you're pushing the blood back up a little bit, and you're having more rapid movement of the blood. So the white cells are getting more activated and you're getting a bigger boost to your immune system there. So you can do this contrast hot foot bath from hot to cold. Do 3 cycles usually, 3 minutes in the hot, 1 minute in the cold. And remember to keep yourself covered up while you're doing this. Don't let your body get chilled. This is useful to help increase white cells. And even if you're not sick, this can be used as a prophylactic measure. So you just want to help your immune system. You can do this a few times a week because you want to do everything you can to keep that immune system stronger. And here's a picture of this gentleman here in the hot foot bath. It should pass your ankles at least. It shouldn't just be your feet like the first picture. It should pass your ankles. And then he's going to the cold here. And up here, this lady's doing it for her hands because she has arthritis. This can be done for arthritis as well. So if you have joint pain, inflammation, you can do hot for 3 minutes, cold for a minute, because you're increasing circulation all throughout the extremity, and that helps with the arthritis inflammation. Okay, so this one here is a chest hydrotherapy. You have some congestion in your lungs and you want to help clear it up. You get a towel and you moisten it. You can put it in hot boiling water and then wring it out so it's dry, or moist, not dripping wet. Or you can moisten it and put it in the microwave so it heats up, maybe about a minute or two. And then you put it in, so you have a hot, moist towel here. You wrap it up with a dry towel so it doesn't burn your chest. Wrap it up with a dry towel. And then place that on the chest for about 10 to 15 minutes. You can place one on the back as well. That will really increase the efficacy. And while you're doing this, you keep the whole body covered and warm. So you go under a blanket. So you're laying down for this on a bed, and you will need help because it's hard to do all these exchanges by yourself. So you have the warm towel wrapped up in a dry towel on your chest, on your back. And after 10 to 15 minutes, then you apply some cold, get a rag that you put in some cold water, wring it out and rub the chest. This is like the cold application part. Do that for about 1 minute and then you repeat the warm towels. You got to get the towel warm again. So dip it again in warm water or put it in the microwave again. Do this for 3 cycles and end with the cold, either a bag of frozen vegetables or dip the rag in ice cold water, wring it out, and then rub the chest. And then cover back up and rest for about an hour. This works really well if you do it about 2 to 3 times a day. If you have chest congestion, chest fullness, asthma, mild pneumonia, this can be very useful for that. All right. We spoke about the hot foot bath already, and we discussed that in our last time together. And I want to encourage you to not be afraid of hydrotherapy, but really give it a chance, give it a shot, and become more acquainted with it.